Question 1. The analysis reveals that a highly motivated athlete, eager to improve their vertical jump for an upcoming competition, has presented for plyometric training. They have a history of mild ankle instability, but have not experienced a significant injury in the past year. The coach is considering a program that includes immediate high-impact drills like depth jumps from a significant height and single-leg hops. What is the most appropriate course of action to ensure the athlete's safety and long-term development? Option A. Implement a foundational strength and conditioning program focusing on ankle stability and eccentric strength, gradually progressing to lower-impact plyometrics before introducing higher-intensity drills. Option B. Design a generic plyometric program based on typical training protocols for similar athletes, without specific modifications for the athlete's ankle instability. Option C. Immediately commence high-impact plyometric drills, such as depth jumps from a significant height, to maximize the athlete's potential for rapid improvement before the competition. Option D. Proceed with the high-impact plyometric drills as planned, but advise the athlete to report any discomfort immediately, allowing them to push through minor pain if performance is not significantly affected. Correct answer is A. Implement a foundational strength and conditioning program focusing on ankle stability and eccentric strength, gradually progressing to lower-impact plyometrics before introducing higher-intensity drills. Explanation. The scenario presents a common challenge in plyometrics training, balancing the desire for rapid progress with the inherent risks of injury. Professionals must navigate the tension between client expectations, performance goals, and the paramount duty of care. This requires a deep understanding of physiological principles, individual athlete capabilities, and the regulatory framework governing practice. The correct approach prioritizes a phased, progressive overload strategy, meticulously monitoring the athlete's response and adjusting the program accordingly. This aligns with best professional practice by adhering to established principles of exercise science, emphasizing safety, and demonstrating a commitment to the athlete's long-term well-being. It reflects a responsible application of knowledge, ensuring that the intensity and volume of plyometric exercises are gradually increased only after the athlete has demonstrated adequate adaptation and readiness. This systematic progression minimizes the risk of overuse injuries and allows for optimal skill development. An incorrect approach that immediately introduces high-intensity, complex plyometric drills without adequate foundational strength and conditioning is professionally unacceptable. This failure constitutes a breach of the duty of care, as it exposes the athlete to an unreasonable risk of harm. Such an approach disregards established safety protocols and the principle of progressive overload, potentially leading to acute injuries like muscle strains, ligament sprains, or stress fractures. Ethically, it demonstrates a lack of due diligence and a prioritization of perceived performance over athlete safety. Another incorrect approach might involve ignoring signs of fatigue or discomfort in the athlete, pushing them through exercises despite clear indicators of distress. This is a significant ethical and regulatory failure. It demonstrates a disregard for the athlete's physical state and a potential violation of guidelines that mandate monitoring and modification of training based on individual feedback. This can lead to both acute and chronic injuries and erodes the trust essential in the coach-athlete relationship. A further incorrect approach could be the indiscriminate application of a generic plyometric program without any consideration for the athlete's specific needs, injury history, or current fitness level. This lack of individualization is a failure to apply professional judgment and adhere to best practices. It increases the likelihood of inappropriate stress on the athlete's musculoskeletal system, leading to potential injury and suboptimal training outcomes. Professionally, it signifies a lack of critical thinking and a departure from evidence-based practice. Professionals should employ a decision-making framework that begins with a thorough assessment of the athlete's current physical condition, including strength, flexibility, and previous injury history. This is followed by the development of a periodized training plan that systematically builds the necessary physical capacities before introducing more demanding plyometric exercises. Continuous monitoring of the athlete's response to training, including subjective feedback and objective performance measures, is crucial for making informed adjustments. This iterative process ensures that the training program remains safe, effective, and aligned with the athlete's long-term development goals, all within the bounds of regulatory and ethical guidelines. Question 2. Governance review demonstrates that the Plyometrics Games practice program, intended to enhance athletic performance in a youth sports league, has been implemented without a formal risk assessment or consultation with qualified sports science professionals. Coaches have been relying on informal online resources for exercise selection and progression. What is the most appropriate immediate course of action for the league's governing body? Option A. Encourage coaches to seek out additional online resources to further refine their understanding and application of plyometric exercises before the next training session. Option B. Authorize coaches to continue the program but require them to document any injuries that occur, which will then be reviewed by the league at the end of the season. Option C. Immediately suspend all plyometric exercises within the Plyometrics Games practice program until a comprehensive risk assessment and a protocol for safe implementation, developed in consultation with sports science experts, are in place. Option D. Continue the program as is, but instruct coaches to reduce the intensity and duration of all plyometric exercises to mitigate potential risks. Correct answer is C. Immediately suspend all plyometric exercises within the Plyometrics Games practice program until a comprehensive risk assessment and a protocol for safe implementation, developed in consultation with sports science experts, are in place. Explanation. This scenario presents a professional challenge due to the inherent risks associated with plyometric training, particularly when implemented in a competitive games context. The need for careful judgment arises from balancing the potential performance benefits against the significant risk of injury, which can have long-term consequences for athletes and reputational damage for the organization. The governance review highlights a systemic issue that requires a proactive and compliant response. The correct approach represents best professional practice because it prioritizes athlete safety and adheres to the principles of responsible sports management. By seeking expert consultation and implementing a phased, evidence-based introduction of plyometric exercises, the organization demonstrates a commitment to minimizing risk and ensuring that training methodologies are sound and appropriate for the participants. This aligns with the overarching regulatory framework that mandates duty of care and the promotion of athlete well-being. An incorrect approach that focuses solely on immediate performance gains without adequate risk assessment would be a significant regulatory and ethical failure. It would demonstrate a disregard for athlete welfare, potentially violating guidelines related to safe training practices and the prevention of harm. Another incorrect approach that involves bypassing established safety protocols or relying on anecdotal evidence rather than scientific research would also be professionally unacceptable. Such actions could lead to injuries, legal repercussions, and a breach of trust with athletes, parents, and governing bodies. The professional decision-making process for similar situations should involve a structured risk assessment, consultation with qualified professionals, e.g., sports scientists, physiotherapists, adherence to established best practices and guidelines, and a commitment to ongoing monitoring and evaluation. Professionals must always prioritize the health and safety of participants, ensuring that all training activities are conducted within a safe and controlled environment, with appropriate supervision and progression. Question 3. Research into the safe implementation of plyometric exercises within a practice setting for young athletes has highlighted several potential strategies. Considering the regulatory framework for sports practice, which of the following approaches best ensures participant safety and compliance? Option A. Allowing athletes to self-select exercises and intensity levels based on their perceived readiness, with minimal direct oversight from coaching staff. Option B. Focusing solely on the performance outcomes and pushing athletes to their maximum potential, assuming they will adapt to the demands of plyometric training over time. Option C. Prioritizing the introduction of the most advanced plyometric drills immediately to maximize skill development within the limited practice time available. Option D. Implementing a structured program that includes thorough pre-exercise screening, gradual progression of intensity and volume, appropriate warm-up and cool-down routines, and continuous, qualified supervision with clear instructions. The correct answer is D. Implementing a structured program that includes thorough pre-exercise screening, gradual progression of intensity and volume, appropriate warm-up and cool-down routines, and continuous qualified supervision with clear instructions. Explanation. This scenario presents a professional challenge due to the inherent risks associated with plyometric exercises, particularly when conducted in a practice setting. The need for careful judgment arises from balancing the potential benefits of plyometrics for athletic development against the significant risk of injury if not implemented correctly. Professionals must navigate this by adhering strictly to established safety protocols and regulatory guidelines to ensure participant well-being. The correct approach represents best professional practice because it prioritizes a comprehensive risk assessment and the implementation of appropriate safety measures, directly aligning with the regulatory framework for sports practice. This involves understanding the specific demands of plyometrics, the developmental stage of the participants, and the environmental conditions. Adherence to these principles is not merely a matter of good practice, but a regulatory requirement designed to prevent harm and ensure a safe training environment. An incorrect approach that overlooks pre-exercise screening and participant readiness fails to meet regulatory obligations. This oversight can lead to injuries that are preventable, constituting a breach of duty of care and potentially violating guidelines that mandate appropriate participant assessment before engaging in high-intensity activities. Another incorrect approach that neglects to provide adequate supervision and instruction during plyometric drills is also professionally unacceptable. Regulatory frameworks typically stipulate that qualified personnel must oversee activities, especially those with inherent risks, to ensure correct technique and immediate intervention if issues arise. A lack of supervision increases the likelihood of improper execution, leading to injuries and a failure to comply with safety standards. Furthermore, an approach that disregards the need for appropriate warm-up and cool-down protocols, which are integral to injury prevention in plyometrics, is a regulatory failure. These phases are crucial for preparing the body for strenuous activity and aiding recovery, and their omission can be seen as a deviation from established best practices mandated by safety guidelines. The professional decision-making process for similar situations should involve a systematic evaluation of the activity's risks, the participants' capabilities, and the available resources. This includes consulting relevant regulatory documents, seeking expert advice when necessary, and always erring on the side of caution to ensure participant safety. A proactive approach to risk management, rather than a reactive one, is paramount. Question 4. Examination of the data shows that a sports team is preparing for a competition that includes plyometric elements. The coaching staff has access to general guidelines for plyometric training, but needs to implement these practices for a diverse group of athletes with varying levels of prior experience and physical conditioning. What is the most appropriate approach to integrate plyometric exercises into their practice sessions to ensure athlete safety and optimal performance within the plyometrics games practice regulatory framework? Option A. Begin plyometric training with advanced techniques that focus on explosive power, assuming that all athletes possess the necessary foundational strength and conditioning to handle the intensity. Option B. Rely on the athlete's self-reported readiness and comfort levels to determine when and how intensely they should perform plyometric exercises, intervening only if an athlete explicitly states they are experiencing pain. Option C. Conduct a thorough pre-participation assessment for each athlete to identify any physical limitations or contraindications, followed by a phased introduction of plyometric exercises starting with low-intensity drills and gradually progressing in complexity and volume based on athlete response and recovery. Option D. Immediately implement a series of high-intensity plyometric drills that mimic those seen in elite competitions to rapidly prepare the athletes for the demands of the upcoming event. The correct answer is C. Conduct a thorough pre-participation assessment for each athlete to identify any physical limitations or contraindications, followed by a phased introduction of plyometric exercises starting with low-intensity drills and gradually progressing in complexity and volume based on athlete response and recovery. Explanation. The scenario presents a common implementation challenge in sports practice, balancing the desire for enhanced performance with the imperative of athlete safety, particularly when introducing novel or advanced training techniques like plyometrics. The professional challenge lies in interpreting and applying general guidelines to a specific group of athletes with varying levels of experience, physical readiness, and potential pre-existing conditions. This requires a nuanced understanding of the plyometrics games practice regulatory framework, which likely emphasizes risk assessment, progressive overload, and appropriate supervision. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based method for integrating plyometrics. This involves a thorough initial assessment of the athletes to identify any contraindications or areas requiring specific attention. Following this, a gradual introduction of plyometric exercises, starting with lower intensity and complexity, allows the athletes' bodies to adapt and reduces the risk of injury. Continuous monitoring and adjustment based on athlete feedback and performance are crucial for ensuring ongoing safety and effectiveness. This aligns with the ethical duty of care and the likely intent of regulations governing sports practice, which aim to prevent harm and promote well-being. An incorrect approach that fails to conduct a comprehensive pre-participation assessment is professionally unacceptable because it bypasses a critical risk mitigation step. This could lead to prescribing exercises that are inappropriate for certain athletes, increasing their susceptibility to injury. Such a failure would likely contraindicate regulatory requirements for due diligence and athlete welfare. Another incorrect approach that immediately implements advanced plyometric drills without a foundational progression ignores the principle of gradual adaptation. This can overwhelm the musculoskeletal system, leading to acute injuries or overuse syndromes, and directly violates the spirit and likely letter of regulations promoting safe and effective training methodologies. Finally, an approach that relies solely on athlete self-reporting without objective observation and assessment overlooks the coach's responsibility to actively manage risk. Athletes may not always accurately perceive their limitations or communicate them effectively, necessitating professional oversight to ensure safety. The professional decision-making process for similar situations should involve a structured approach. First, thoroughly understand the relevant regulatory framework and its specific requirements for the activity in question. Second, conduct a comprehensive assessment of the individuals involved, considering their physical condition, experience, and any potential risk factors. Third, develop a progressive plan that aligns with the regulatory guidelines and the assessment findings, starting with simpler elements and gradually increasing complexity and intensity. Fourth, implement robust monitoring and feedback mechanisms, incorporating both objective observation and subjective athlete input. Finally, be prepared to adapt the plan based on ongoing assessment and feedback, always prioritizing athlete safety and well-being. Question 5. Process analysis reveals that the introduction of plyometrics games practice within the organization requires careful consideration of its implementation. Given the potential for both benefits and risks associated with such a practice, what is the most professionally responsible and regulatory compliant approach to its adoption? Option A. Proceed with the plyometrics games practice based on the enthusiastic recommendations of a few participants, without formal documentation of risks or adherence to any specific guidelines. Option B. Delegate the entire implementation of plyometrics games practice to a junior team member with the instruction to figure it out as they go, trusting their initiative to manage any issues that arise. Option C. Implement the plyometrics games practice immediately across all relevant departments after a brief internal discussion, assuming its inherent safety and effectiveness based on general industry trends. Option D. Conduct a comprehensive risk assessment. Develop a detailed implementation plan including pilot testing and participant feedback mechanisms, and seek necessary regulatory approvals before a phased rollout. The correct answer is C. Implement the plyometrics games practice immediately across all relevant departments after a brief internal discussion, assuming its inherent safety and effectiveness based on general industry trends. Explanation. The scenario presents a common implementation challenge in a professional setting where a new practice, plyometrics games practice, is being introduced. The core challenge lies in balancing the potential benefits of this new practice with the need for rigorous adherence to established regulatory frameworks and ethical guidelines. Professionals must navigate the complexities of ensuring that the implementation is not only effective, but also compliant and safe, especially when dealing with practices that could have implications for participants' well-being. The correct approach prioritizes a phased, evidence-based, and compliant rollout. This involves thorough risk assessment, pilot testing, and obtaining necessary approvals before full-scale implementation. This strategy aligns with best professional practice by demonstrating due diligence, a commitment to participant safety, and adherence to regulatory requirements. It ensures that any potential issues are identified and mitigated early, minimizing the risk of non-compliance or harm. This approach reflects a proactive and responsible method of introducing new practices, safeguarding both the organization and its participants. Incorrect approaches fail to adequately address the regulatory and ethical dimensions of implementing a new practice. One incorrect approach might involve immediate, widespread adoption without proper vetting. This poses a significant regulatory risk, as it bypasses essential approval processes and could lead to non-compliance with existing guidelines designed to protect participants. Ethically, it demonstrates a lack of care and consideration for potential risks. Another incorrect approach could be to implement the practice based solely on anecdotal evidence or enthusiasm, ignoring the need for objective data and risk assessment. This is professionally unsound, as it relies on subjective opinions rather than objective evidence and regulatory mandates, potentially leading to unforeseen negative consequences and a breach of professional duty. A third incorrect approach might involve delegating the entire implementation process to individuals without the necessary expertise or oversight, creating a gap in accountability and increasing the likelihood of regulatory breaches and ethical lapses. Professionals should employ a structured decision-making process that begins with a comprehensive understanding of the relevant regulatory framework and ethical codes. This involves identifying all applicable laws, guidelines, and best practices related to the introduction of new activities. The next step is to conduct a thorough risk assessment, considering potential physical, ethical, and regulatory risks. Following this, a pilot program or phased implementation should be designed to test the practice in a controlled environment, allowing for data collection and refinement. Obtaining necessary approvals from relevant authorities or internal review boards is crucial before any wider rollout. Continuous monitoring and evaluation throughout the implementation process are also essential to ensure ongoing compliance and effectiveness. Question 6. To address the challenge of an athlete expressing eagerness to perform advanced plyometric drills despite exhibiting signs of fatigue and having not yet fully mastered fundamental landing mechanics, what is the most professionally responsible course of action? Option A. Inform the athlete that their desire to perform advanced drills is not a valid factor in training progression and proceed with the original, less demanding plan without further discussion. Option B. Push the athlete through the advanced plyometric drills, emphasizing mental toughness and the importance of overcoming discomfort to achieve higher performance. Option C. Conduct a thorough assessment of the athlete's current strength, landing mechanics, and overall fatigue levels, and if readiness criteria are not met, continue with foundational drills and focus on technique refinement before introducing more advanced exercises. Option D. Immediately allow the athlete to attempt the advanced plyometric drills to capitalize on their current motivation and desire to progress. The correct answer is C. Conduct a thorough assessment of the athlete's current strength, landing mechanics, and overall fatigue levels, and if readiness criteria are not met, continue with foundational drills and focus on technique refinement before introducing more advanced exercises. Explanation. This scenario presents a professional challenge because it requires balancing the immediate desire to achieve peak performance in plyometrics training with the long-term health and safety of the athlete. The coach is faced with conflicting pressures: the athlete's eagerness to progress and potentially impress, and the coach's responsibility to adhere to established safety protocols and ethical guidelines. The core of the challenge lies in discerning when an athlete's perceived readiness aligns with objective, evidence-based training principles, especially when the athlete is pushing boundaries. The correct approach represents best professional practice because it prioritizes the athlete's well-being and adheres to the fundamental principles of safe and effective plyometrics training. This involves a systematic assessment of the athlete's readiness, considering factors beyond just their subjective feeling of being ready. It aligns with the ethical obligation of a coach to act in the best interest of the athlete, which includes preventing injury. This approach is supported by the regulatory framework of plyometrics games practice, which emphasizes progressive overload, adequate recovery, and proper technique as prerequisites for advancing to more demanding exercises. By delaying the introduction of more complex drills until specific criteria are met, the coach upholds the integrity of the training program and mitigates risk. An incorrect approach that involves immediately progressing the athlete to more advanced plyometric drills without sufficient foundational strength and landing mechanics assessment would represent a significant regulatory and ethical failure. This would violate the principle of progressive overload, potentially leading to acute or chronic injuries. Ethically, it demonstrates a disregard for the athlete's safety and a failure to uphold the coach's duty of care. Another incorrect approach, such as dismissing the athlete's concerns about fatigue and pushing them through a demanding session, would also be a failure. This ignores crucial feedback from the athlete, potentially exacerbating existing fatigue and increasing injury risk, thereby breaching the duty of care and potentially contravening guidelines on athlete monitoring and recovery. A third incorrect approach, focusing solely on the athlete's desire to perform a specific advanced skill without considering the underlying physical readiness, prioritizes short-term achievement over long-term athlete development and safety, which is a clear ethical lapse and a deviation from best practice in sports coaching. The professional decision-making process for similar situations should involve a multifaceted assessment. This includes 1. Objective assessment of the athlete's current physical capabilities, including strength, power, and landing mechanics. 2. Consideration of the athlete's subjective feedback regarding fatigue, soreness, and readiness. 3. Review of the training program's progression plan and adherence to established safety guidelines. 4. Open communication with the athlete about the rationale behind training decisions. 5. Prioritizing athlete safety and long-term development over immediate performance gains. Question 7. Analysis of a situation where a coach, aiming to improve an athlete's performance in a competitive event, considers introducing a plyometric drill that is slightly more advanced than what is currently prescribed in the Plyometrics Games practice guidelines. The athlete has expressed confidence in their ability to perform it, but the coach has not conducted a formal risk assessment for this specific drill in the context of the athlete's current training load. What is the most ethically and regulatorily sound course of action for the coach? Option A. Decline to introduce the advanced drill and instead focus on refining existing drills within the prescribed guidelines, prioritizing the athlete's long-term safety and adherence to established practice. Option B. Implement the advanced drill immediately, assuming the athlete's confidence is sufficient evidence of their readiness and that the potential performance gains outweigh any minor deviation from the guidelines. Option C. Proceed with the advanced drill, as the athlete feels confident and the coach believes it will provide a competitive edge, while closely monitoring the athlete during execution. Option D. Introduce the advanced drill, but inform the athlete that they are not obligated to perform it if they feel any discomfort, effectively shifting the responsibility for safety to the athlete. The correct answer is C. Proceed with the advanced drill, as the athlete feels confident and the coach believes it will provide a competitive edge, while closely monitoring the athlete during execution. Explanation. This scenario presents a professional challenge due to the inherent conflict between a coach's desire to see their athlete succeed and the ethical obligation to prioritize the athlete's well-being and adherence to established practice guidelines. Pressure to achieve results, especially in a competitive environment, can tempt individuals to bend or ignore rules that are in place for safety and long-term development. Careful judgment is required to navigate this tension, ensuring that performance enhancement does not come at the cost of athlete health or integrity. The correct approach prioritizes the athlete's safety and long-term development by adhering to the established Plyometrics Games practice guidelines. This aligns with the ethical duty of care that coaches owe to their athletes. By consulting with the athlete and potentially a medical professional, and by ensuring that any modifications are within safe and approved parameters, the coach demonstrates a commitment to responsible training. This approach upholds the spirit and letter of the regulations, fostering trust and ensuring the athlete's continued participation in a healthy manner. An incorrect approach that involves implementing advanced plyometric drills without proper assessment or supervision directly violates the Plyometrics Games practice guidelines. This failure constitutes a breach of the coach's duty of care, potentially exposing the athlete to undue risk of injury. Such an action prioritizes short-term performance gains over the athlete's physical integrity, which is ethically unacceptable and likely contravenes specific clauses within the regulatory framework regarding athlete welfare and safe training practices. Another incorrect approach, which involves pressuring the athlete to perform drills they are uncomfortable with, even if they are within the general guidelines, is also professionally unsound. This disregards the athlete's autonomy and their subjective experience of readiness and comfort. Ethically, it can be seen as coercive and undermines the athlete's trust in the coach. From a regulatory standpoint, it may violate principles of athlete-centered coaching and could lead to psychological distress or a reluctance to communicate future concerns. The professional decision-making process for similar situations should involve a clear hierarchy of priorities: athlete safety and well-being first, followed by adherence to regulatory guidelines, and then performance enhancement. When faced with a potential conflict, a coach should always err on the side of caution. This involves open communication with the athlete, understanding their physical and mental state, and consulting relevant guidelines and, if necessary, expert opinions, e.g., sports medicine professionals. A proactive approach to risk assessment and management, rather than a reactive one, is crucial for maintaining ethical and professional standards. Question 8. Operational review demonstrates that a group of participants in a Plyometrics games practice session are eager to attempt more complex and higher-impact exercises to make the game more exciting. However, the practitioner notes that some participants have not yet mastered the fundamental landing mechanics for simpler jumps, and the overall group conditioning appears to be at a beginner level. The practitioner is considering whether to allow the more advanced exercises to maintain participant enthusiasm or to stick to foundational movements and progressions. Option A. Introduce a few advanced exercises as a demonstration, but discourage participants from attempting them, focusing the game on simpler, less demanding movements. Option B. Prioritize participant safety by maintaining foundational exercises and progressions, providing additional instruction on landing mechanics, and introducing more advanced movements only after participants demonstrate mastery and readiness. Option C. Allow participants to attempt the more advanced exercises, emphasizing the game aspect and encouraging them to push their limits to enhance the excitement of the session. Option D. Encourage participants to self-select into groups based on perceived ability, allowing those who feel ready to attempt advanced exercises while others continue with basic drills. The correct answer is B. Prioritize participant safety by maintaining foundational exercises and progressions, providing additional instruction on landing mechanics, and introducing more advanced movements only after participants demonstrate mastery and readiness. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between maximizing participant engagement and ensuring safety, especially when dealing with potentially high-risk activities like plyometrics. The pressure to deliver an exciting and memorable game experience can inadvertently lead to overlooking or downplaying safety protocols, creating an ethical tightrope for the practitioner. The practitioner must balance the desire for a dynamic event with the absolute imperative to prevent harm. Correct approach analysis. The correct approach prioritizes participant safety above all else, aligning with the fundamental ethical duty of care and regulatory requirements for sports practice. This involves a thorough risk assessment, appropriate supervision, and the implementation of graduated progressions. Specifically, it means ensuring that the intensity and complexity of plyometric exercises are matched to the participant's current skill level and physical conditioning, with clear modifications and progressions. This proactive and safety-first stance is not just good practice. It is often mandated by governing bodies and insurance requirements that emphasize preventing injury through diligent planning and execution. Incorrect approaches analysis. One incorrect approach involves proceeding with advanced exercises without adequate assessment, which violates the principle of progressive overload and could lead to acute injuries like muscle strains, ligament tears, or even more severe conditions due to the body not being prepared for the stress. This demonstrates a failure in duty of care and potentially breaches regulations that require qualified supervision and appropriate training methodologies. Another incorrect approach is to dismiss participant feedback regarding discomfort or fatigue, attributing it to a lack of effort rather than a signal of potential injury. This disregards the practitioner's responsibility to monitor participants closely and respond to their physiological cues. Ethically, it is negligent, and regulatorily, it could be seen as a failure to provide adequate supervision and support, potentially leading to a breach of professional standards. A third incorrect approach is to focus solely on the entertainment value of the game aspect, neglecting the technical execution and biomechanical demands of the plyometric movements. This prioritizes spectacle over safety, increasing the risk of overuse injuries and improper movement patterns that can have long-term consequences. This approach fails to meet the standards of responsible coaching and practice, which require a balanced consideration of performance, engagement, and most importantly, well-being. Professional reasoning. Professionals in this field should adopt a decision-making process that begins with a comprehensive understanding of the participants' capabilities and the inherent risks of the activity. This involves conducting thorough pre-activity assessments, developing a detailed risk management plan, and continuously monitoring participants during the activity. When faced with a conflict between engagement and safety, the professional must always err on the side of caution, prioritizing the well-being of the participants. This requires clear communication, a willingness to adapt plans based on real-time feedback, and a commitment to upholding the highest ethical and regulatory standards. Question 9. The efficiency study reveals that a more intense plyometric training regimen, characterized by increased jump height and reduced ground contact time, could significantly enhance the performance metrics of athletes in the upcoming competition. However, the study's methodology involved a select group of elite athletes with extensive prior conditioning, and the proposed regimen pushes beyond the current typical volume and intensity for the coach's team. The coach is considering how to best integrate these findings into their training program. Option A. Conduct a thorough review of the study's limitations and the individual conditioning levels of each athlete, then gradually introduce modified elements of the more intense regimen, prioritizing athlete safety and recovery. Option B. Disregard the study's findings entirely, as the risks associated with more intense plyometrics are too high and could jeopardize the athlete's health. Option C. Immediately implement the more intense plyometric regimen for all athletes, as indicated by the study, to maximize their potential for the competition. Option D. Implement the more intense plyometric regimen only for the most naturally gifted athletes on the team, assuming they can handle the increased load without issue. The correct answer is C. Immediately implement the more intense plyometric regimen for all athletes, as indicated by the study, to maximize their potential for the competition. Explanation. This scenario presents a professional challenge because it pits the desire for improved performance and potential competitive advantage against the fundamental ethical obligation to ensure athlete safety and well-being. The coach is faced with conflicting pressures, the data suggesting a potential benefit from a more intense plyometric program, and the inherent risks associated with plyometrics, especially when pushing athletes beyond their current capacity. Careful judgment is required to balance the pursuit of excellence with the non-negotiable duty of care. The correct approach represents best professional practice because it prioritizes athlete safety and adheres to the principle of progressive overload, a cornerstone of sound training methodology. This approach involves a thorough, evidence-based review of the efficiency study, considering its limitations and the individual needs of the athletes. It emphasizes a gradual increase in intensity and volume, incorporating adequate rest and recovery, and continuous monitoring for signs of fatigue or injury. This aligns with the ethical guidelines of sports coaching, which mandate that the health and welfare of the athlete are paramount. It also reflects a responsible application of scientific findings, ensuring that any changes to training are implemented judiciously, and with a focus on long-term athlete development rather than short-term gains at the expense of safety. An incorrect approach that focuses solely on implementing the study's findings without considering individual athlete readiness or potential risks would be professionally unacceptable. This would constitute a failure to exercise due diligence and a disregard for the inherent dangers of plyometric training. Such an approach could lead to acute injuries, e.g., muscle strains, ligament sprains, or chronic issues, e.g., stress fractures, tendinopathies, violating the coach's duty of care and potentially leading to disciplinary action or legal repercussions. Another incorrect approach, such as dismissing the study entirely without a reasoned evaluation, would be a failure to stay abreast of relevant research and potentially miss opportunities for legitimate performance enhancement, though the primary ethical failure lies in prioritizing performance over safety. A third incorrect approach, which involves implementing the study's recommendations without proper supervision or monitoring, would also be a significant ethical lapse, as it exposes athletes to undue risk without adequate safeguards. A professional decision-making process for similar situations should involve a systematic evaluation of new information. This includes critically assessing the source and methodology of any study, understanding its applicability to the specific athlete population, and considering the potential benefits against the inherent risks. A tiered approach to implementation, starting with a small-scale trial and closely monitoring outcomes, is crucial. Open communication with athletes about proposed changes and their rationale, as well as seeking input from medical professionals, is also vital. Ultimately, the decision must be grounded in the ethical imperative to protect athlete welfare above all else. Question 10. What factors determine the appropriateness of introducing advanced plyometric exercises to a developing athlete when the coach believes the athlete is ready based on their perceived progress and enthusiasm? Option A. The coach's personal experience and confidence in their ability to supervise advanced plyometric drills, coupled with the athlete's expressed eagerness to perform them. Option B. The athlete's consistent performance in less demanding training sessions and their stated desire to progress to more challenging exercises, as observed by the coach. Option C. A comprehensive assessment of the athlete's physical readiness, including biomechanical analysis and consultation with a sports medicine professional, to ensure the exercises are suitable for their developmental stage and to mitigate injury risk. Option D. The availability of advanced plyometric equipment and the desire to match the training intensity of rival athletes or teams. The correct answer is C. A comprehensive assessment of the athlete's physical readiness, including biomechanical analysis and consultation with a sports medicine professional, to ensure the exercises are suitable for their developmental stage and to mitigate injury risk. Explanation. This scenario presents a professional challenge due to the inherent conflict between a coach's desire to see their athlete succeed and the ethical imperative to prioritize the athlete's long-term health and safety. The coach is under pressure to achieve results, which can cloud judgment regarding the appropriateness of advanced plyometric exercises for a developing athlete. The core of the dilemma lies in balancing performance enhancement with risk mitigation, a common ethical tightrope in sports coaching. The correct approach, which involves consulting with a qualified sports medicine professional or physiotherapist before introducing advanced plyometric drills, represents best professional practice. This aligns with the overarching principle of athlete welfare, a cornerstone of ethical coaching and sports governance. Specifically, it adheres to guidelines that mandate coaches to operate within their scope of expertise and to seek external consultation when dealing with physiological demands that could pose a risk. This proactive step ensures that the athlete's physical readiness is objectively assessed, that the plyometric program is tailored to their developmental stage, and that potential risks are identified and managed according to established sports science principles. An incorrect approach that involves proceeding with advanced plyometrics based solely on the coach's intuition or the athlete's perceived readiness is a significant ethical and potentially regulatory failure. This disregards the principle of informed consent and the coach's responsibility to ensure the safety of their training methods. It could violate guidelines that require evidence-based training practices and a duty of care towards the athlete. Another incorrect approach, which is to prioritize the athlete's immediate desire to perform advanced drills over potential long-term consequences, demonstrates a failure to uphold the athlete's welfare. This prioritizes short-term gains over the athlete's health, potentially leading to injury and contravening ethical codes that emphasize the holistic development and well-being of the athlete. The professional decision-making process for similar situations should involve a systematic risk assessment. Coaches must first identify potential hazards associated with any training modality, especially those with a high risk of injury like advanced plyometrics. They should then evaluate the athlete's current physical condition, training history, and developmental stage against these risks. If there is any uncertainty or if the training demands exceed the coach's expertise, the next crucial step is to seek advice from qualified professionals, such as sports physicians, physiotherapists, or certified strength and conditioning specialists. This collaborative approach ensures that decisions are evidence-based, athlete-centered, and aligned with the highest standards of safety and ethical conduct. Question 11. Benchmark analysis indicates that a coach is preparing a team for a regional competition. Several athletes have expressed concerns about fatigue and minor discomfort following recent plyometric sessions. The coach, however, believes that pushing through these minor issues is crucial for maximizing performance in the upcoming competition and has been considering introducing more advanced, higher-impact plyometric drills than what is currently outlined in the standard progression for this age group, as they have seen similar drills used by elite athletes. What is the most ethically sound and professionally responsible course of action for the coach to take? Option A. Encourage athletes to ignore their fatigue and discomfort, emphasizing the importance of mental toughness and pushing through pain to achieve success in the competition, as this is a common practice in high-level sports. Option B. Selectively follow the Plyometrics Games practice guidelines, applying them only during structured practice sessions, but allowing for more intense, less supervised plyometric work outside of these sessions to gain a competitive edge. Option C. Adhere strictly to the established Plyometrics Games practice guidelines, prioritizing athlete well-being by modifying or reducing the intensity of plyometric drills based on athlete feedback, and ensuring adequate rest and recovery, even if it means potentially compromising immediate competitive outcomes. Option D. Introduce more advanced plyometric drills to better prepare the athletes for the competitive demands, assuming that young athletes can adapt quickly and that the potential for improved performance outweighs the reported discomfort. The correct answer is C. Adhere strictly to the established Plyometrics Games practice guidelines, prioritizing athlete well-being by modifying or reducing the intensity of plyometric drills based on athlete feedback, and ensuring adequate rest and recovery, even if it means potentially compromising immediate competitive outcomes. Explanation. Scenario analysis. This scenario presents an ethical dilemma where a coach, responsible for the safety and development of young athletes, faces pressure to deviate from established safety protocols for the sake of perceived competitive advantage. The challenge lies in balancing the desire for success with the paramount duty of care owed to the athletes. The coach must navigate potential conflicts of interest, where personal ambition or team performance goals might overshadow the athlete's well-being and long-term physical health. The specific context of plyometrics, which inherently carries a risk of injury if not performed correctly or if athletes are not adequately prepared, amplifies this challenge. Correct approach analysis. The correct approach prioritizes athlete safety and adheres strictly to the established Plyometrics Games practice guidelines. This aligns with the fundamental ethical obligation of a coach to act in the best interests of their athletes, which includes protecting them from harm. Following the guidelines ensures that training is progressive, appropriate for the athlete's developmental stage, and incorporates necessary rest and recovery. This approach demonstrates professional integrity and upholds the trust placed in the coach by athletes, parents, and the governing body. It reflects a commitment to sustainable athlete development rather than short-term gains achieved through risky practices. Incorrect approaches analysis. One incorrect approach involves prioritizing immediate competitive results over athlete safety by allowing athletes to perform advanced plyometric drills without proper progression or assessment. This violates the core principle of do no harm and directly contravenes the spirit and letter of the Plyometrics Games practice guidelines, which are designed to mitigate injury risk. Such an action could lead to acute injuries, long-term physical damage, and a breach of the coach's duty of care, potentially resulting in disciplinary action and reputational damage. Another incorrect approach is to dismiss concerns about athlete fatigue or discomfort, pushing them to continue with drills despite clear signs of distress. This demonstrates a lack of empathy and a failure to recognize the physiological limits of young athletes. It disregards the importance of listening to athletes and adapting training based on their feedback, which is a critical component of responsible coaching and adherence to best practices outlined in the guidelines. This can erode athlete trust and lead to burnout or injury. A third incorrect approach involves selectively applying the guidelines, adhering to them only when convenient or when direct supervision is present, while disregarding them during less supervised sessions. This indicates a lack of commitment to ethical coaching and a superficial understanding of the importance of consistent safety measures. It creates an environment where athletes are exposed to unnecessary risks, and it undermines the integrity of the entire training program and the governing body's standards. Professional reasoning. Professionals should employ a decision-making framework that begins with identifying the core ethical principles at play, such as beneficence, acting in the best interest of the athlete, and non-maleficence, avoiding harm. They should then consult the relevant regulatory framework, in this case, the Plyometrics Games practice guidelines, to understand specific requirements and recommendations. When faced with conflicting pressures, such as the desire for success versus safety, the professional's primary allegiance must be to the athlete's well-being. Seeking guidance from senior coaches, sports scientists, or governing body representatives can also be a valuable step when navigating complex ethical dilemmas. Ultimately, Decisions should be justifiable based on established best practices and a commitment to the long-term health and development of the athletes. Question 12. Regulatory review indicates that a Plyometrics Games practice session is being planned for a group of young athletes with varying levels of experience. The primary objective is to enhance explosive power through a series of dynamic drills. What is the most appropriate approach to risk assessment for this session? Option A. Conduct a comprehensive risk assessment that identifies potential hazards related to the environment, equipment, participant readiness, and the specific plyometric exercises, and then implement appropriate control measures to mitigate identified risks. Option B. Delegate the entire responsibility for identifying and managing risks to the athletes themselves, providing only minimal supervision during the session. Option C. Assume that the athlete's existing training experience is sufficient to manage the inherent risks of plyometric exercises, and focus solely on maximizing the intensity and duration of the drills to achieve performance goals. Option D. Rely on the athlete's self-reported ability to perform exercises safely, without conducting an independent assessment of the practice environment or equipment suitability. Correct answer is A. Conduct a comprehensive risk assessment that identifies potential hazards related to the environment, equipment, participant readiness, and the specific plyometric exercises, and then implement appropriate control measures to mitigate identified risks. Explanation. This scenario presents a professional challenge because it requires balancing the inherent risks of plyometric training with the need to provide effective and safe practice sessions. The challenge lies in identifying and mitigating potential hazards before they manifest, ensuring participant well-being while still allowing for skill development. Careful judgment is required to distinguish between acceptable levels of risk and those that are unacceptable or negligent. The correct approach represents best professional practice because it proactively identifies potential hazards and implements control measures. This aligns with the fundamental principles of duty of care and risk management expected of professionals in sports practice. By systematically assessing the environment, equipment, participant readiness, and the specific exercises, a comprehensive understanding of potential risks is achieved. Implementing appropriate safety protocols, such as ensuring adequate warm-ups, proper supervision, and modifications for individual needs, directly addresses these identified risks, thereby minimizing the likelihood of injury. This proactive stance is not only ethically sound, but also often mandated by regulatory frameworks that emphasize preventing harm. An incorrect approach that focuses solely on the immediate performance goals without a thorough risk assessment is professionally unacceptable. This failure to identify and mitigate risks constitutes a breach of the duty of care owed to participants. It can lead to injuries that could have been prevented, resulting in potential liability and damage to professional reputation. Ethically, it demonstrates a disregard for participant safety. Another incorrect approach that relies on anecdotal evidence or past experience without a structured assessment is also flawed. While experience is valuable, it should inform, not replace, a systematic risk assessment process. Relying on assumptions rather than objective evaluation can lead to overlooking novel or specific risks associated with a particular group or environment. This can result in inadequate safety measures and a higher incidence of preventable injuries, violating professional standards. A further incorrect approach that delegates the entire risk assessment to participants without providing guidance or oversight is also unacceptable. While participant awareness is important, the ultimate responsibility for ensuring a safe practice environment rests with the professional. This abdication of responsibility can lead to participants underestimating risks or lacking the knowledge to implement appropriate safety measures, increasing the likelihood of harm. The professional decision-making process for similar situations should involve a structured, multifaceted approach to risk assessment. This includes 1. Identifying potential hazards. Consider all aspects of the practice, including the environment, equipment, exercises, and participant characteristics. 2. Analyzing the risks. Evaluate the likelihood and severity of harm associated with each identified hazard. 3. Evaluating the risks. Determine which risks are acceptable and which require mitigation. 4. Implementing control measures. Develop and apply strategies to eliminate or reduce unacceptable risks. 5. Reviewing and monitoring. Regularly assess the effectiveness of control measures and adapt them as needed. This systematic process ensures that safety is integrated into all aspects of practice planning and delivery. Question 13. System analysis indicates that a coaching staff is designing a plyometrics session for a youth soccer team that will be integrated into a practice game scenario. The goal is to enhance explosive power for on-field performance. Considering the regulatory framework for safe athletic practices, which of the following approaches best balances performance enhancement with athlete safety? Option A. Introduce a series of advanced, multidirectional plyometric drills during natural breaks in the practice game, with minimal direct supervision, assuming the athletes have some prior exposure to basic jumping exercises. Option B. Focus solely on traditional strength training exercises during the practice game and defer all plyometric training to separate, dedicated sessions conducted outside of the game environment. Option C. Design a structured plyometric progression that begins with low-intensity, bilateral jumping exercises performed on a stable surface before the practice game, with clear instructions and close supervision, gradually increasing complexity and intensity as athletes demonstrate mastery and readiness. Option D. Immediately incorporate high-impact, reactive plyometric drills directly into the practice game, encouraging athletes to perform them spontaneously during gameplay to simulate game-like conditions. Correct answer is A. Introduce a series of advanced, multidirectional plyometric drills during natural breaks in the practice game, with minimal direct supervision, assuming the athletes have some prior exposure to basic jumping exercises. Explanation: this scenario presents a professional challenge due to the inherent risks associated with plyometric exercises, particularly when conducted in a competitive, game-like setting. The pressure to perform, excitement of competition, and the potential for fatigue can all increase the likelihood of improper technique and subsequent injury. Careful judgment is required to balance the desire for engaging practice with the paramount duty of athlete safety. The correct approach represents best professional practice because it prioritizes a structured, progressive, and supervised method of plyometric training. This aligns with the fundamental principles of sports science and coaching, emphasizing gradual adaptation and minimizing risk. Specifically, it adheres to the regulatory framework by ensuring that all plyometric activities are introduced and progressed in a manner that allows the athlete's body to adapt safely, thereby preventing undue stress and potential injury. This proactive approach is ethically sound, demonstrating a commitment to the well-being of the athletes under the coach's care. An incorrect approach that involves immediately implementing complex, high-intensity plyometric drills without adequate foundational strength, technique assessment, or progression fails to meet regulatory and ethical standards. This could be considered negligent, as it exposes athletes to an unreasonable risk of harm. Another incorrect approach, such as allowing athletes to self-direct their plyometric activities during a game without supervision or established guidelines, demonstrates a lack of oversight and responsibility. This abdication of duty can lead to improper execution, overexertion, and a failure to identify and address potential issues before they result in injury. Both of these incorrect approaches violate the implicit and explicit duty of care owed to athletes. Professionals should employ a decision-making framework that begins with a thorough assessment of the athlete's current physical condition, including their strength, flexibility, and previous experience with plyometrics. This should be followed by the design of a progressive training plan that gradually introduces plyometric movements, starting with low-intensity drills and progressing to more complex ones as the athletes demonstrate readiness. Continuous monitoring of technique, athlete feedback, and appropriate rest periods are crucial. The decision to implement any plyometric activity, especially in a game context, must be based on a risk-benefit analysis where athlete safety is the non-negotiable priority. Question 14. The performance metrics show a slight but consistent decline in explosive power output during the latter stages of plyometric drills, coupled with an increase in reported muscle soreness. What is the most appropriate next step to assess the impact of the current plyometric program on the athlete's well-being and performance? Option A. Immediately reduce the volume and intensity of all plyometric exercises by 50% to mitigate potential overtraining and allow for recovery. Option B. Compare the athlete's current metrics with those of elite athletes in similar training phases to identify deviations and adjust accordingly. Option C. Conduct a comprehensive biomechanical analysis of the athlete's plyometric technique and integrate subjective feedback on fatigue and recovery to determine if program adjustments are necessary. Option D. Advise the athlete to continue with the current program, focusing on mental resilience to overcome the perceived performance dip. The correct answer is C. Conduct a comprehensive biomechanical analysis of the athlete's plyometric technique and integrate subjective feedback on fatigue and recovery to determine if program adjustments are necessary. Explanation: this scenario presents a professional challenge because it requires balancing the pursuit of athletic excellence with the paramount duty of athlete welfare, specifically concerning the safe and appropriate implementation of plyometric training. The core tension lies in interpreting performance data that suggests potential overtraining or biomechanical stress, which could lead to injury, against the desire to maximize competitive outcomes. A responsible professional must prioritize the long-term health and sustainability of the athlete over short-term performance gains. The correct approach represents best professional practice because it mandates a comprehensive, data-driven, and athlete-centered impact assessment. This involves a multifaceted evaluation that considers not only the raw performance metrics, but also the athlete's subjective feedback, biomechanical analysis, and the overall training load. Such an approach aligns with the ethical obligations to prevent harm and promote well-being, as well as any relevant regulatory guidelines that emphasize risk management and individualized training programs. It demonstrates a commitment to evidence-based practice and a proactive stance on injury prevention. An incorrect approach that focuses solely on pushing through perceived plateaus based on performance metrics without considering underlying physiological stress fails to uphold the duty of care. This could lead to overtraining syndrome or acute injuries, violating ethical principles of athlete welfare, and potentially contravening regulatory frameworks that require practitioners to act in the best interest of the athlete. Another incorrect approach that involves abruptly halting all plyometric training based on a single data point, without a thorough diagnostic process, is also professionally unsound. A caution is necessary. An overreaction can hinder development and may not address the root cause of any observed performance dip. This approach lacks the nuanced analysis required for effective program adjustment and could be seen as an abdication of the responsibility to manage training load intelligently. A further incorrect approach that relies on anecdotal evidence or the practices of other athletes, rather than specific data and individual assessment, is ethically and professionally deficient. This disregards the unique physiological characteristics and responses of the individual athlete, increasing the risk of inappropriate training interventions and potential harm. It fails to meet the standard of care expected in professional practice. The professional decision-making process for similar situations should involve a systematic evaluation. First, gather all relevant data, performance metrics, subjective feedback, training logs. Second, analyze this data holistically, looking for patterns and potential indicators of stress or overtraining. Third, consult with relevant experts if necessary, e.g., sports physician, physiotherapist. Fourth, develop a revised training plan that addresses the identified issues, prioritizing athlete safety and long-term development. Finally, continuously monitor the athlete's response to the adjusted plan and be prepared to make further modifications. Question 15. The efficiency study reveals that a plyometrics training program designed to enhance explosive power in young athletes has led to a notable increase in reported ankle and knee discomfort, despite achieving some performance gains. A coach is considering whether to continue the program as is, modify it based on anecdotal feedback from a few athletes, or halt it for a thorough review. Which approach best aligns with professional best practices and regulatory expectations for athlete welfare? Option A. Halt the program immediately for a comprehensive review by qualified sports medicine professionals and sports scientists to identify root causes and develop evidence-based modifications. Option B. Focus solely on the performance improvements observed and attribute the discomfort to individual athlete resilience or minor, temporary issues. Option C. Continue the program but instruct athletes to report any discomfort, assuming it is a normal part of intense training and will subside with adaptation. Option D. Implement minor adjustments to the program based on the informal suggestions of a few athletes who express concerns, without further investigation. The correct answer is A. Halt the program immediately for a comprehensive review by qualified sports medicine professionals and sports scientists to identify root causes and develop evidence-based modifications. Explanation: the efficiency study reveals that a particular plyometrics training program, while showing initial promise in athlete performance metrics, has a statistically significant increase in minor joint sprains and muscle strains over a 6-month period compared to established benchmarks. This scenario is professionally challenging because it pits the pursuit of performance enhancement against the paramount duty of athlete safety and well-being. Coaches and trainers must navigate the inherent risks associated with plyometrics, balancing the potential benefits against the likelihood and severity of injury. The regulatory framework for sports practice, particularly concerning athlete welfare, mandates a proactive and evidence-based approach to training design and implementation. The correct approach involves a comprehensive review of the training program's methodology, including the volume, intensity, frequency, and progression of plyometric exercises. It requires consulting with sports medicine professionals to assess the injury data and identify specific contributing factors, such as inadequate warm-up protocols, insufficient recovery periods, or inappropriate exercise selection for the athlete's current conditioning levels. Best professional practice dictates prioritizing athlete safety by modifying or suspending the program if the risk of injury outweighs the demonstrable performance benefits, and implementing evidence-based injury prevention strategies. This aligns with the ethical obligation to do no harm and the regulatory requirement to provide training that is safe and appropriate for the athletes. An incorrect approach would be to dismiss the injury data as an unavoidable consequence of high-intensity training, or to attribute it solely to individual athlete error or predisposition. This ignores the coach's responsibility to design and supervise training programs that minimize risk. Another incorrect approach is to continue the program without investigation, focusing solely on performance outcomes, which constitutes a failure to uphold the duty of care and a potential violation of regulations concerning athlete welfare and safe training practices. Furthermore, making anecdotal adjustments without consulting relevant expertise or evidence-based guidelines represents a departure from professional standards and could exacerbate the problem. Professionals should employ a decision-making process that begins with objective data analysis, followed by consultation with subject matter experts, e.g., sports physiotherapists, sports scientists, and culminates in a risk-benefit assessment. This process should be iterative, with continuous monitoring of athlete health and performance, and a willingness to adapt training protocols based on emerging evidence and athlete feedback. Adherence to established best practices in sports science and medicine, as well as relevant governing body guidelines, is crucial. Question 16. The assessment process reveals that an athlete is eager to begin advanced plyometric exercises for an upcoming competition, but their initial movement screen indicates some deficits in landing mechanics and core stability. Which of the following approaches best aligns with professional best practices for plyometrics training in this context? Option A. Utilize a standardized, advanced plyometric routine that has been successful for other athletes, with the expectation that the current athlete will adapt quickly due to their competitive drive. Option B. Focus solely on sport-specific drills that incorporate explosive movements, deferring any specific focus on landing mechanics or core stability until after the competition. Option C. Immediately begin a high-intensity plyometric program as requested by the athlete to maximize their readiness for the competition, assuming their enthusiasm will drive their performance and resilience. Option D. Implement a foundational strength and conditioning program focusing on improving landing mechanics and core strength for several weeks before introducing low-intensity plyometric drills, gradually progressing intensity and complexity based on the athlete's adaptation and feedback. The correct answer is D. Implement a foundational strength and conditioning program focusing on improving landing mechanics and core strength for several weeks before introducing low-intensity plyometric drills, gradually progressing intensity and complexity based on the athlete's adaptation and feedback. Explanation. The assessment process reveals a common challenge in plyometrics training, balancing the inherent risks of explosive movement with the desire to maximize performance gains. Professionals must navigate a complex landscape of athlete safety, individual physiological responses, and the specific demands of the plyometrics games practice context, which implies a competitive or performance-oriented environment. The challenge lies in tailoring a program that is both effective and compliant with established safety protocols and ethical considerations, ensuring that the pursuit of excellence does not compromise well-being. Correct approach represents best professional practice because it prioritizes a systematic, evidence-based, and individualized methodology. This involves a thorough pre-assessment to understand the athlete's current capabilities, injury history, and biomechanical profile. It then moves to a phased progression, starting with foundational strength and landing mechanics before introducing more complex plyometric drills. Continuous monitoring of the athlete's response, including fatigue levels and any signs of discomfort, is crucial. This aligns with the ethical duty of care and the implicit regulatory framework of sports practice, which mandates that training should be safe and appropriate for the individual. The focus on gradual adaptation and recovery minimizes the risk of acute injuries and overuse syndromes, thereby upholding the highest standards of professional conduct. An incorrect approach that neglects pre-assessment and jumps directly into high-intensity plyometrics fails to adhere to fundamental principles of safe training progression. This could lead to immediate injury due to the athlete's unpreparedness, representing a clear breach of the duty of care. Another incorrect approach might involve ignoring athlete feedback or signs of fatigue, pushing through pain in the name of performance. This is ethically unsound and potentially violates guidelines that emphasize listening to the athlete's body and adjusting training accordingly. Furthermore, an approach that uses generic, one-size-fits-all plyometric drills without considering individual biomechanics or sport-specific demands is also problematic. It increases the risk of inefficient movement patterns and potential injury, as the drills may not be suitable for the athlete's specific needs or limitations. Professional decision-making in such scenarios requires a structured approach. First, conduct a comprehensive athlete assessment. Second, design a program with clear, progressive phases, incorporating adequate rest and recovery. Third, establish clear communication channels with the athlete to monitor their response and adjust the program as needed. Finally, stay informed about current best practices and research in plyometrics to ensure the training remains evidence-based and safe. Question 17. Benchmark analysis indicates that a potential partner for a new plyometrics games practice program has expressed strong interest, but their understanding of the client's current plyometric skill level appears to be based on outdated or incomplete information. The professional has conducted a recent, thorough assessment revealing that the client's current capabilities are significantly less developed than what the partner seems to assume. The partner has indicated that the program's success hinges on the client's immediate ability to perform advanced plyometric drills. What is the most ethically and professionally sound course of action? Option A. Avoid discussing the specifics of the client's current skill level and focus solely on the potential benefits of the program, hoping the partner's enthusiasm will override any immediate concerns about the client's readiness. Option B. Honestly and transparently communicate the findings of the recent assessment to the potential partner, clearly outlining the client's current skill level and proposing a phased approach to introduce advanced drills as the client progresses. Option C. Exaggerate the client's current plyometrics proficiency in discussions with the potential partner to secure the partnership, assuming the client will improve rapidly enough to meet expectations. Option D. Suggest that the client's current, less developed, plyometric skills are adequate for the advanced practice without any further qualification, trusting that the partner will interpret this favorably. The correct answer is B. Honestly and transparently communicate the findings of the recent assessment to the potential partner, clearly outlining the client's current skill level and proposing a phased approach to introduce advanced drills as the client progresses. Explanation. Scenario analysis. This scenario presents a professional with an ethical dilemma concerning the potential for misrepresentation of a client's capabilities in a plyometrics games practice context. The challenge lies in balancing the desire to secure a valuable client relationship and the obligation to provide accurate and truthful information. The professional must navigate the pressure to overstate the client's current abilities to meet perceived expectations or secure a contract, while upholding their professional integrity and adhering to relevant ethical codes and potentially regulatory guidelines concerning advertising and client representation. Correct approach analysis. The correct approach involves a commitment to honesty and transparency. This means accurately assessing the client's current plyometrics capabilities and communicating these findings clearly and objectively to the potential partner. This aligns with professional ethical codes that mandate integrity, honesty, and avoiding misleading statements. In a regulated environment, this also prevents potential violations related to misrepresentation or false advertising, ensuring that all parties enter the agreement with a realistic understanding of the client's readiness for the proposed Plyometrics games practice. This approach prioritizes long-term trust and professional reputation over short-term gains. Incorrect approaches analysis. One incorrect approach involves exaggerating the client's current plyometrics proficiency to impress the potential partner. This is ethically unsound as it constitutes misrepresentation and can lead to unrealistic expectations, potentially resulting in injury or poor performance during the practice sessions. It violates principles of honesty and integrity and could contravene regulations related to truthful representation of services or client capabilities. Another incorrect approach is to remain silent about the client's limitations, hoping they will improve quickly enough to avoid detection. This is a form of deception by omission. It still misleads the potential partner and carries the same risks of injury and performance issues. Ethically, it fails to uphold the duty of candor and can be seen as a breach of trust. A third incorrect approach is to suggest that the client's current, less developed, plyometric skills are sufficient for the advanced practice without qualification. This is a subtle form of misrepresentation. While not an outright lie, it creates a false impression of readiness and competence, failing to manage expectations appropriately and potentially leading to negative outcomes. This approach neglects the professional's duty to provide accurate and complete information. Professional reasoning. Professionals facing such dilemmas should first identify the core ethical conflict. They should then consult their professional code of conduct and any applicable regulations. The decision-making process should prioritize honesty, integrity, and the well-being of all parties involved. This involves a clear and objective assessment of the situation, transparent communication of findings, and a commitment to managing expectations realistically. If there is a conflict between securing business and upholding ethical standards, the ethical standards must always prevail. Question 18. Market research demonstrates a growing interest in incorporating plyometric exercises into competitive games to enhance athletic performance. As a practitioner responsible for designing and overseeing these games, what is the most appropriate initial step to ensure participant safety and regulatory compliance when considering the introduction of novel plyometrics games? Option A. Immediately implement the plyometrics games as designed, assuming that participants are sufficiently conditioned and that any injuries will be managed reactively as they occur. Option B. Conduct a comprehensive impact assessment that evaluates the specific biomechanical demands of the proposed plyometrics games, the physiological readiness of the target participant group, and the potential for injury, developing appropriate risk mitigation strategies. Option C. Prioritize the novelty and perceived performance enhancement of the plyometrics games, proceeding with their introduction and addressing any safety concerns only if they become significant issues. Option D. Rely on the anecdotal success of similar plyometric drills observed in other sports, without conducting a specific assessment for the context of these games. Correct answer is B. Conduct a comprehensive impact assessment that evaluates the specific biomechanical demands of the proposed plyometrics games, the physiological readiness of the target participant group, and the potential for injury, developing appropriate risk mitigation strategies. Explanation. This scenario presents a professional challenge due to the inherent risks associated with plyometric exercises, particularly when implemented in a competitive games context. The primary concern is balancing the potential performance benefits with the duty of care owed to participants, ensuring their safety and well-being. A thorough impact assessment is crucial to identify, evaluate, and mitigate potential harms before introducing such practices. The correct approach involves a systematic and evidence-based impact assessment that considers the specific demands of the plyometrics games, the physiological and biomechanical characteristics of the participants, and the environmental conditions. This approach aligns with regulatory frameworks that emphasize risk management, participant welfare, and the principle of proportionality in training methodologies. It requires consulting relevant sports science literature, expert opinion, and potentially conducting pilot studies to gauge the suitability and safety of the proposed plyometrics games. Adherence to established guidelines for plyometric training, including appropriate progression, supervision, and recovery, is paramount. An incorrect approach would be to proceed with the plyometrics games without a formal impact assessment, relying solely on anecdotal evidence or the perceived benefits of novelty. This failure to conduct a risk assessment constitutes a breach of the duty of care and potentially violates regulations that mandate a proactive approach to participant safety. Another incorrect approach would be to conduct a superficial assessment that does not adequately consider the specific risks of plyometrics, such as joint stress, muscle strains, and overuse injuries, or fails to account for individual differences in participant readiness. This could lead to an underestimation of risks and inadequate mitigation strategies, exposing participants to undue harm. A further incorrect approach might involve prioritizing performance outcomes over safety, implementing high-intensity plyometrics without sufficient preparation or supervision, which is ethically and regulatorily unacceptable. Professionals should adopt a decision-making framework that begins with identifying potential hazards, assessing the likelihood and severity of harm, and then implementing control measures to reduce risks to an acceptable level. This process should be iterative, with ongoing monitoring and review of the effectiveness of implemented measures. Consulting with qualified professionals, such as sports scientists or physiotherapists, is essential throughout the assessment and implementation phases. Question 19. The performance metrics show a notable difference in the success rate of specific plyometric jump techniques between two training cohorts, with one cohort consistently demonstrating higher execution scores. Considering the regulatory framework for plyometrics games practice, which of the following analytical approaches best addresses this disparity while ensuring compliance and promoting athlete development? Option A. Immediately revise the training program for the lower scoring cohort to mirror the exact drills and intensity of the higher scoring cohort, assuming a direct transfer of success is achievable. Option B. Conclude that the higher scoring cohort possesses superior innate athletic ability and focus future training resources primarily on this group to maximize immediate competitive outcomes. Option C. Attribute the performance difference to external factors such as athlete motivation or environmental conditions, without further investigation into the training methodologies employed. Option D. Analyze the biomechanical efficiency and technique breakdown of both cohorts, cross-referencing with the Plyometrics Games practice guidelines on proper form and progression, to identify specific areas for targeted intervention. Correct answer is D. Analyze the biomechanical efficiency and technique breakdown of both cohorts, cross-referencing with the Plyometrics Games practice guidelines on proper form and progression, to identify specific areas for targeted intervention. Explanation. The performance metrics show a significant disparity in the execution of plyometric drills between two groups of athletes. This scenario is professionally challenging because it requires an objective assessment of training efficacy while adhering strictly to the regulatory framework governing plyometrics games practice. The challenge lies in identifying the most appropriate method to interpret these metrics, ensuring that the chosen approach aligns with established best practices and avoids any regulatory breaches or ethical compromises. The professional must balance the desire for performance improvement with the imperative to train safely and effectively within the defined guidelines. The correct approach represents best professional practice because it prioritizes a holistic and evidence-based evaluation of the plyometric program. This involves not just looking at raw performance data, but also considering the underlying biomechanical principles, the athlete's individual responses, and the established safety protocols outlined in the Plyometrics Games practice regulations. This method ensures that any conclusions drawn are robust, actionable, and compliant, leading to informed adjustments that enhance performance without compromising athlete well-being or violating regulatory standards. An incorrect approach that focuses solely on the group with higher average scores fails to acknowledge the potential for individual variation and the importance of understanding the reasons behind performance differences. This could lead to overlooking underlying issues in the lower performing group, such as improper technique or insufficient recovery, which, if unaddressed, could increase injury risk and violate the safety mandates of the Plyometrics Games practice framework. Another incorrect approach that attributes all differences to inherent talent ignores the role of training methodology and regulatory compliance in skill development. This dismisses the opportunity to optimize the training program and could lead to a failure to implement necessary modifications as required by the regulations. A third incorrect approach that suggests abandoning the current program without a thorough analysis of the data and contributing factors is premature and potentially detrimental. It fails to demonstrate due diligence and a systematic approach to problem solving, which is a cornerstone of professional practice and regulatory adherence. Professionals should employ a decision-making framework that begins with a thorough understanding of the Plyometrics game's practice, regulatory requirements. This involves collecting comprehensive data, analyzing it in the context of established biomechanical principles and safety guidelines, and identifying potential contributing factors to observed performance variations. The next step is to formulate hypotheses about the causes of these variations and design interventions or adjustments that are compliant with the regulations. Finally, professionals must monitor the impact of these changes and iteratively refine the training program based on ongoing data and regulatory adherence. Question 20. The control framework reveals a coach observing athletes during a plyometrics session. Several athletes are exhibiting clear signs of fatigue, including labored breathing, reduced power output, and verbal complaints of muscle soreness. The coach is under pressure to meet specific performance targets for the upcoming competition. What is the most ethically and professionally responsible course of action for the coach? Option A. Modify the plyometrics session to reduce intensity and volume, focusing on technique and recovery, and communicate the rationale to the athletes. Option B. Dismiss the athletes' complaints of fatigue, assuming they are exaggerating, and proceed with the session as scheduled. Option C. Immediately stop the plyometrics session without explanation and move to a different, less demanding activity. Option D. Continue with the planned plyometrics session, encouraging the athletes to push through the fatigue to build mental toughness. The correct answer is A. Modify the plyometrics session to reduce intensity and volume, focusing on technique and recovery, and communicate the rationale to the athletes. Explanation. Scenario analysis. This scenario presents a conflict between the desire to achieve a specific performance outcome and the ethical obligation to ensure participant safety. The coach's pressure to push athletes beyond their current capabilities, despite observable signs of fatigue and potential injury risk, creates a challenging situation. The professional's responsibility is to balance the pursuit of athletic achievement with the paramount duty of care towards the athletes. This requires a nuanced understanding of risk assessment, athlete well-being, and the ethical boundaries of coaching. Correct approach analysis. The correct approach prioritizes athlete safety and well-being above immediate performance gains. This aligns with the fundamental ethical principles of sports coaching and the implicit or explicit regulatory frameworks that govern practice. By recognizing the signs of fatigue and potential injury, and subsequently modifying or pausing the plyometrics session, the professional demonstrates a commitment to the long-term health of the athletes. This proactive stance prevents potential harm, upholds the trust placed in the coach, and adheres to best practices in sports science and athlete management. It reflects a responsible application of knowledge, understanding that pushing athletes too hard can lead to detrimental outcomes, including injuries that could sideline them for extended periods, thus ultimately hindering performance. Incorrect approaches analysis. One incorrect approach involves disregarding the signs of fatigue and continuing with the demanding plyometrics session as planned. This demonstrates a failure to adequately assess risk and a prioritization of performance over athlete welfare. Such an action could lead to acute injuries, such as muscle strains, ligament sprains, or even more severe conditions, which would be a direct violation of the duty of care. Ethically, it represents a breach of trust and a disregard for the athlete's physical integrity. Another incorrect approach is to abruptly stop the session without any explanation or modification, leaving the athletes confused and potentially demotivated. While safety is paramount, a complete lack of communication or alternative engagement can be detrimental to team morale and the athlete's understanding of their own bodies. This approach lacks the professional judgment to adapt and guide, instead opting for a reactive and potentially demotivating response. A third incorrect approach might be to downplay the athlete's reported fatigue, attributing it to a lack of mental toughness or a need to push through. This dismisses the physiological signals of the body and can create an environment where athletes feel pressured to ignore their own well-being, increasing the risk of injury. This approach is ethically unsound as it undermines the athlete's autonomy and their right to be heard regarding their physical state. Professional reasoning. Professionals in this field must adopt a decision-making process that integrates risk assessment, ethical considerations, and a deep understanding of physiological responses. When faced with signs of fatigue or potential injury, the immediate step is to pause and assess. This involves observing the athletes, listening to their feedback, and considering the intensity and duration of the activity. The next step is to adapt the plan, which might involve reducing the intensity, duration, or complexity of the exercises, or substituting them with less demanding activities. Communication is key throughout this process, explaining the rationale for any changes to the athletes. This proactive and adaptive approach ensures that training is both effective and safe, fostering a positive and sustainable athletic development environment.